September 24, 1944. The engine coughs. Inside the C-47's aluminum belly, 24 wounded men lie strapped to canvas litters stacked 3 high along the fuselage walls. The drone of twin Pratt & Whitney engines has been their only companion for the past 3 hours. A mechanical lullaby over endless Pacific blue. First Lieutenant Mary Louise Hawkins moves between the rows, checking pulses, adjusting morphine drips, her hands steady despite the turbulence. The smell is overwhelming, a mixture of aviation fuel, antiseptic, blood, and fear. Through the small circular window she sees nothing but ocean stretching to the horizon. They left Palau an hour ago, headed for the hospital facilities at Guadalcanal. Some of these men have shrapnel buried deep in their chests. Others have lost limbs. One Marine keeps whispering his mother's name. The co-pilot appears in the doorway, his face pale. 3 words that change everything. We're out of fuel. Below them, somewhere in the Solomon Islands chain, lies Bellona Island. 8 miles long, covered in jungle, no airstrip. The pilot banks hard. They're going down. The Pacific War had reached its bloody crescendo by the autumn of 1944. For 3 years, American forces had been clawing their way across thousands of miles of ocean, island by island, atoll by atoll, paying for each conquered beach with blood. The strategy called island hopping had bypassed some Japanese strongholds, but others had to be taken by force. Palau was one of them. The island chain sat 500 miles east of the Philippines, a strategic position the Japanese had fortified with concrete bunkers, interconnected caves, and 10,000 determined soldiers who had sworn never to surrender. On September 15, 1944, the 1st Marine Division stormed ashore at Peleliu, the largest island in the Palau Group. Military planners had estimated the battle would last 3 days. They were catastrophically wrong. What followed was some of the most brutal fighting of the entire Pacific campaign. The Japanese commander, Colonel Kunio Nakagawa, had abandoned the traditional beach defense strategy. Instead, he ordered his men to retreat into a complex warren of coral caves and tunnels that honeycombed the island's central ridgeline, a hellish landscape known as Bloody Nose Ridge. The Marines advanced into a killing zone where every yard was contested, where enemy soldiers emerged from hidden positions to attack and then vanished underground before American firepower could respond. Flamethrowers became essential weapons. Tanks fired point-blank into cave mouths. The tropical heat exceeded 110 degrees. Men collapsed from heat stroke as often as they fell to enemy bullets. The coral rock shattered into razor-sharp fragments when hit by artillery, creating secondary wounds that shredded flesh and clothing. By September 24th, 9 days into the battle, American casualties had exceeded 7,000 men. Wounded Marines lay in makeshift aid stations near the beach, waiting for evacuation. The medical infrastructure was overwhelmed. Field hospitals operated in tents, surgeons working 20-hour shifts under canvas roofs that provided no protection from the heat. Blood supplies ran critically low. Morphine was rationed. The most seriously wounded needed immediate evacuation to rear area hospitals with proper surgical facilities, refrigerated blood banks, and X-ray equipment. That meant flights to Guadalcanal, 600 miles to the southeast, where the United States had established a major base complex with full hospital capabilities. The workhorses of this aerial lifeline were C-47 Skytrain aircraft, the military version of the Douglas DC-3 commercial airliner. These twin-engine transports could carry 18 to 24 patients on stretchers, attended by a flight nurse and medical technician. The flights saved countless lives, getting critical patients to surgery within hours instead of days. But these mercy missions came with risks. The C-47 was a reliable aircraft, sturdy and forgiving, but it was not designed for combat zones. Its aluminum skin offered no protection against ground fire. Its cruising speed of 160 miles per hour made it vulnerable to enemy fighters. And its fuel capacity, while sufficient for most routes, left little margin for error. Pilots calculated fuel loads carefully, balancing the weight of patients, medical equipment, and crew against the distance to be covered. Navigation over the Pacific required precision. Radio beacons helped, but weather could force detours. Headwinds increased fuel consumption. Every mission was a calculated gamble. The flight nurses who staffed these evacuation missions were volunteers, women who had completed specialized training in air evacuation procedures. They learned how to manage patients at altitude, where thinner air affected breathing and blood pressure. They learned how to secure litters so turbulence wouldn't throw wounded men against the fuselage walls. They learned how to recognize the signs of shock, hemorrhage, and respiratory distress in patients who couldn't speak, who were unconscious or delirious with pain. First Lieutenant Mary Louise Hawkins had graduated at the top of her class from the Army Air Force School of Air Evacuation at Bowman Field, Kentucky. She had volunteered for Pacific duty, knowing the conditions would be harsh, the facilities primitive, and the danger constant. By September 1944, she had flown dozens of evacuation missions, moving wounded men from forward aid stations to rear hospitals. Her presence often the difference between life and death for soldiers bleeding out at 20,000 feet. On the morning of September 24th, she received orders for another routine evacuation flight. The aircraft assigned was C-47A number 4348236, a relatively new Skytrain that had been delivered to the Pacific Theater earlier that year. The pilot and co-pilot were experienced transport veterans. The manifest listed 24 patients from Peleliu, all requiring immediate hospitalization at Guadalcanal. Hawkins conducted her pre-flight checks, inventorying medical supplies, oxygen bottles, plasma, and morphine ampules. The loading process at Peleliu took over an hour. Each wounded man had to be carried aboard on a litter and secured to the rack system that lined both sides of the fuselage. Some patients were unconscious, heavily sedated to manage pain during transport. Others were alert, their eyes following every movement, desperate for reassurance that they were finally leaving this nightmare island. Hawkins moved among them, checking identification tags, reading medical charts hastily scrawled by field surgeons, assessing who needed immediate attention and who could wait. Several men had compound fractures, bones protruding through torn flesh. One Marine had taken shrapnel across his abdomen, the field dressing already soaked through with blood. Another had suffered severe burns when a flamethrower backfired, his hands wrapped in gauze that couldn't hide the smell of charred tissue. A young private, barely 20 years old, had lost his right leg below the knee. The morphine kept him calm, but his lips moved constantly, forming silent words that might have been prayers. The C-47 lifted off from Peleliu's rough coral airstrip just after noon. The island fell away beneath them, a scarred landscape of shell craters, burned vegetation, and the skeletal remains of Japanese fortifications. Smoke still rose from Bloody Nose Ridge where fighting continued. The aircraft banked east, setting course for Guadalcanal across 600 miles of open ocean. At cruising altitude, Hawkins began her in-flight assessments, moving from patient to patient, checking vital signs, adjusting oxygen masks, administering medications. The noise inside the unpressurized fuselage made conversation impossible. The engines roared, a constant vibration that rattled equipment and made her teeth ache. She worked by touch and observation, reading the language of wounds and vital signs that transcended words. 2 hours into the flight, she noticed the young private with the amputated leg had developed a fever. His forehead burned under her palm. Infection was setting in despite the sulfa powder the field surgeons had packed into the wound. She increased his fluid intake, knowing he needed intravenous antibiotics that only a proper hospital could provide. The Solomon Islands chain stretched across 1,000 miles of the South Pacific. Dozens of islands ranging from major land masses like Guadalcanal and Bougainville to tiny coral atolls barely large enough to support a coconut palm. During 1942 and 1943, these islands had been the scene of desperate fighting as American and Japanese forces battled for control. Names like Guadalcanal, Tulagi, and New Georgia had entered military history written in blood. By late 1944, most of the Solomons were firmly under American control, but the infrastructure remained primitive. Airfields existed on the major islands, built by engineers who carved runways from jungle and coral. Communication networks connected the bases, radio stations maintaining contact with aircraft transiting the region. But vast stretches of ocean and jungle remained empty, places where an aircraft in distress would find no help, no landing field, no rescue. Bellona Island lay in the southern Solomons, about 120 miles south of Guadalcanal. It measured roughly 8 miles long and 3 miles wide, a raised coral platform covered in dense tropical forest. The native population lived in small villages, maintaining traditional ways largely unchanged by the war that raged around them. No American military presence existed on Bellona. No airstrip, no radio station, no garrison. The island appeared on navigation charts as a small speck, notable only as a landmark for aircraft and ships passing through the region. Its coral cliffs rose abruptly from the sea, offering few beaches where landing craft could come ashore. The interior was thick jungle, almost impenetrable, broken only by small clearings where villages stood. 3 hours into the flight from Peleliu, the pilot noticed the fuel gauges dropping faster than his calculations predicted. Headwinds had been stronger than forecast, forcing the engines to work harder, burning fuel at an increased rate. He recalculated the distance to Guadalcanal. The numbers didn't look good. The co-pilot suggested diverting to an alternate field, but the nearest suitable airstrip lay on San Cristobal Island, and even that was questionable with their current fuel state. They discussed turning back, but Peleliu was now too far behind them. The mathematics of aviation left no room for optimism. They were committed to moving forward, gambling that the fuel would last just long enough. The pilot reduced engine power to conserve what remained, lowering their airspeed and altitude. The aircraft descended toward the ocean, skimming above the waves where the air was denser, and the engines could operate more efficiently. Hawkins felt the change immediately. The angle of the deck shifted. The engine note dropped. Something was wrong. She made her way forward to the cockpit, bracing herself against the fuselage as the aircraft bucked through rough air. The pilot didn't need to explain. She saw the fuel gauges, the needles hovering near empty. She saw the chart spread across his lap, his finger marking their position in the middle of nowhere. Below them, the ocean stretched endlessly. Ahead, barely visible through the cockpit windscreen, a dark shape emerged from the haze. An island. Small, covered in green, surrounded by white coral beaches. The pilot pointed. Bellona. They had perhaps 10 minutes of fuel remaining. Maybe less. He would attempt a landing, though calling it a landing seemed almost absurd. There was no runway, no cleared space, just jungle and coral rock. He would put the aircraft down in whatever clearing he could find and pray the landing gear held. Hawkins returned to her patients. She began securing equipment, tightening straps, preparing for impact. The wounded men sensed something wrong. Those who were conscious turned their heads, watching her face for signs of panic. She kept her expression, calm, professional, though her heart hammered against her ribs. Mary Louise Hawkins was 23 years old when she climbed aboard that C-47 on September 24, 1944. Born in Denver, Colorado, on May 24, 1921, she had grown up during the Depression years, learning early the value of resourcefulness and determination. Her decision to become a nurse came from a desire to help others, a calling that intensified as war engulfed the world. She completed her nursing training and enlisted in the Army Nurse Corps in 1942, joining thousands of other women who answered the nation's call. But Hawkins wanted more than a stateside hospital assignment. She volunteered for flight nurse training, a relatively new specialty that combined nursing skills with aviation medicine. The selection process was rigorous. Candidates needed excellent health, steady nerves, and the ability to make life-or-death decisions without supervision. The training program at Bowman Field taught them altitude physiology, how oxygen deprivation affected wounds and vital signs. They learned to recognize the subtle signs of hypoxia, the dangerous condition where insufficient oxygen reached the brain. They practiced working in cramped spaces, managing patients while the aircraft pitched and rolled through turbulence. Hawkins excelled in every aspect of training, graduating first in her class of 39 nurses. Her instructors noted her remarkable composure under pressure, her ability to assess a situation and act decisively. These qualities would be tested beyond anything her training could have prepared her for. The human dimension of air evacuation went beyond medical procedures. These flight nurses became the last friendly face many wounded soldiers saw before surgery, the steady presence that helped terrified young men endure pain and uncertainty. Hawkins developed a reputation among the air crews for her dedication. She would work double shifts when casualties were heavy, refusing rest while wounded men needed care. She wrote letters for soldiers who couldn't hold a pen, promising to mail them when they reached Guadalcanal. She held the hands of dying men, speaking softly to them even when they were too far gone to respond. The technology that carried these mercy missions across the Pacific represented both triumph and limitation. The C-47 Skytrain was a marvel of aviation engineering, a design so successful that over 10,000 were built during the war. Its twin Pratt & Whitney R-1830 engines produced 1,200 horsepower each, enough to lift the aircraft with a full load of patients and equipment. The aircraft's range of 1,600 miles seemed generous, but that figure assumed optimal conditions: no headwinds, no detours, and no combat damage. In reality, Pacific operations constantly pushed aircraft to their limits. The C-47's unpressurized cabin meant flights had to stay below 10,000 feet to keep patients stable, but low altitude exposed the aircraft to worse weather and increased fuel consumption. The pilots who flew these missions walked a constant tightrope between speed and fuel economy, between altitude and patient safety. The C-47 assigned to the Peleliu evacuation flight on September 24th was a relatively new aircraft, manufactured earlier in 1944. Its maintenance logs showed no significant problems. The engines were reliable. The fuel system functioned properly. But no amount of engineering could overcome simple mathematics. The distance from Peleliu to Guadalcanal measured approximately 600 miles. Under normal conditions, the C-47 could make this flight with fuel to spare. But Pacific weather was never normal. Forecasts were primitive, based on scattered observations from ships and island stations. Pilots often discovered wind conditions very different from what they had been briefed. On September 24th, the C-47 encountered headwinds stronger than predicted, invisible rivers of air flowing from east to west that pushed against the aircraft, forcing the engines to work harder. Each minute of flight burned fuel faster than calculated. The medical crisis that made this particular evacuation flight so urgent stemmed from the nature of combat on Peleliu. This was not the rapid mobile warfare of island invasions. This was cave-to-cave fighting, brutal close-quarters combat where men died from grenades, flamethrowers, and bayonets, as often as from bullets. The wounds inflicted in such fighting were catastrophic. Shrapnel from grenades created multiple penetrating injuries. Burns from flamethrowers required specialized treatment that field hospitals couldn't provide. Compound fractures from cave collapses needed orthopedic surgery with proper anesthesia and sterile operating rooms. The 24 men aboard the C-47 that day represented the most critical cases, soldiers who would die without immediate advanced medical care. Field surgeons had done what they could, stabilizing bleeding, immobilizing fractures, administering morphine and sulfa drugs. But their wounds demanded more than battlefield medicine could offer. They needed X-rays to locate embedded shrapnel. They needed blood transfusions from properly typed and cross-matched donors. They needed surgical teams who could work for hours under proper lighting with sterilized instruments. Every hour of delay increased the risk of infection, shock, and death. The decision to evacuate these specific patients on this specific flight was made by medical officers who weighed dozens of factors: the severity of wounds, the likelihood of survival with treatment, the availability of transport. It was a calculus of desperation, trying to save as many lives as possible with limited resources. The command decision to authorize emergency evacuation flights from Peleliu reflected the brutal arithmetic of the battle. By September 24th, 9 days into the operation, American casualties had reached levels that shocked even veteran commanders. The 1st Marine Division had been rendered combat ineffective, losing over 40% of its strength. The casualty rates exceeded those from Tarawa, previously considered the bloodiest battle in Marine Corps history. Division Commander Major General William Rupertus, who had confidently predicted a 3-day victory, now presided over a nightmare that showed no signs of ending. Medical officers reported that the division's clearing stations were overwhelmed, unable to handle the steady stream of wounded arriving from the front lines. The decision to continue aggressive air evacuation operations despite the risks came from higher headquarters. Wounded men were dying in field hospitals that lacked the facilities to save them. Aircraft represented their only chance. Flight nurses and transport crews were ordered to maximize the number of evacuation missions, accepting risks that would have been considered unacceptable under other circumstances. The military command structure understood that some aircraft might be lost, that some crews might not return, but the alternative was watching wounded soldiers die for lack of treatment. It was a cold calculation, but war was filled with such calculations. The men waiting on the ground at Peleliu existed in a state of physical and psychological extremity that defied description. Those conscious enough to understand their situation knew they were being evacuated, knew that survival meant getting off this island. The sound of an approaching C-47 brought hope, the knowledge that someone was coming for them, that they hadn't been abandoned. For many, the sight of a flight nurse represented the first woman they had seen in months, a reminder of a world beyond combat and death. The presence of a woman in that brutal environment carried symbolic weight far beyond her medical function. She represented home, normalcy, the possibility of a future. Soldiers who had fought through hell found themselves suddenly vulnerable, breaking down in tears when gentle hands checked their wounds. The flight nurse became confidant, sister, mother, and angel all at once. The psychological impact of evacuation went both ways. Flight nurses witnessed the true cost of war in ways that rear echelon personnel never did. They saw what modern weapons did to human bodies. They watched young men die despite everything medical science could do. They returned from each mission carrying memories that would haunt them for decades. Mary Louise Hawkins had already flown dozens of such missions by September 24th. She had seen men die in flight, had held pressure on wounds while the aircraft bounced through storms, had made impossible decisions about which patient needed help first. The cumulative stress of this work was immense, yet she continued to volunteer for every available mission. Weather and environmental factors on September 24th created the perfect conditions for disaster. The tropical Pacific in autumn was a cauldron of atmospheric instability. Thunderstorms built rapidly, towering to 40,000 feet, far above any altitude the C-47 could reach. These storms generated violent turbulence, downdrafts, and wind shear that could tear an aircraft apart. Pilots learned to navigate around the worst cells, but this meant deviating from the most direct route, adding miles and minutes to each flight. The headwinds encountered on the Peleliu to Guadalcanal route that day were strong enough to reduce the C-47's ground speed significantly. What should have been a 3.5-hour flight stretched longer. The pilots, monitoring their fuel gauges, faced a gradual realization that they might not make it. There was no single moment of crisis, just the slow, inexorable mathematics of fuel consumption versus distance remaining. They could have turned back earlier, but the point of no return passed without clear recognition. By the time they understood the severity of their situation, Peleliu was as far behind them as Guadalcanal was ahead. They were committed. The ocean below offered no mercy. Water temperature in the tropical Pacific hovered around 80 degrees, warm enough to prevent immediate hypothermia but cold enough to kill within hours. The C-47 could potentially ditch in the ocean, a controlled water landing, but with 24 immobilized patients strapped to litters, evacuation would be nearly impossible. Most of the wounded couldn't swim. Many couldn't even move. A water landing meant drowning for the majority of those aboard. The pilots understood this. They needed land, any land, even if it meant attempting an impossible landing on an unprepared surface. When Bellona Island appeared through the haze, it represented the only option. The island's geography worked against them. Coral cliffs surrounded much of the coastline, rising 30 to 40 feet above the sea. The interior was dense jungle, broken only by small clearings near native villages. From altitude, the pilots could see a few possible landing sites, open areas perhaps large enough to accommodate the C-47's wingspan. But these clearings were surrounded by trees, approached through narrow corridors that left no room for error. A conventional landing approach was impossible. The aircraft would have to come in steep and fast, committing to the landing with no opportunity to abort if the approach looked bad. The pilots made their decision. They would attempt to land in the largest clearing visible from the air, a space near the center of the island that might, just barely, be long enough to stop the aircraft before it crashed into the trees at the far end. The C-47 descended through 3,000 feet, then 2,000, the engine sputtering as fuel starvation began. The pilot reduced airspeed to just above stalling speed, trying to stretch every remaining drop of fuel into a few more seconds of controlled flight. Through the cockpit windscreen, Bellona Island grew larger, its green canopy revealing individual trees, clearings, and the white line of surf breaking against coral. The co-pilot called out altitude and airspeed in a steady voice that betrayed no emotion, though both men knew they were attempting something that violated every principle of safe flying. Inside the cargo bay, Hawkins braced herself against the bulkhead, her eyes moving across the faces of her patients. Some had fallen unconscious. Others stared at the ceiling, lips moving in silent prayer. The young private with the amputated leg turned his head toward her, and she saw in his eyes a trust so complete it nearly broke her composure. She moved to his side, placing her hand on his shoulder, squeezing once. The pilot selected a clearing roughly 400 yards long, oriented east to west. Trees surrounded it on all sides, rising 60 to 80 feet, their branches forming a natural barrier that left only a narrow corridor of approach. The normal landing procedure for a C-47 involved a gradual descent at a shallow angle, touching down gently on the main landing gear before lowering the tail wheel. That technique required at least 3,000 feet of runway. The clearing below offered barely a tenth of that distance. The pilot would have to bring the aircraft in steeply, almost vertically, dropping it into the clearing like a falling leaf, then slamming on the brakes the instant the wheels touched earth. There would be no second chance. If the approach angle was too shallow, they would overshoot and crash into the far trees. If it was too steep, they would stall and fall out of the sky. The margin between survival and death measured in degrees of angle and seconds of timing. At 500 feet, the pilot committed. He pulled back the throttles, allowing the aircraft to drop. The nose came up, increasing drag, slowing airspeed to barely 80 miles per hour. The C-47 mushed through the air, wallowing on the edge of aerodynamic control. The clearing rushed up to meet them, a patch of brown earth and green grass surrounded by jungle. The co-pilot called out altitude. 300 feet. 200. 100. The tree line flashed past on both sides, branches close enough to touch. 50 feet. The pilot leveled the wings, holding the nose up, feeling for the ground. The main landing gear struck Earth with tremendous force, the impact traveling through the airframe like an explosion. The tires compressed, then rebounded. The aircraft bounced back into the air, still carrying forward momentum. The pilot shoved the control yoke forward, forcing the aircraft back down. The second impact was even harder. Metal groaned. Rivets popped. The main gear struts compressed to their limits, absorbing energy that threatened to tear them from the wings. Inside the cargo bay, the violence was indescribable. Hawkins was thrown against the bulkhead, her shoulder striking metal with enough force to leave a bruise that would last for weeks. Equipment tore loose from restraints, flying through the air. A medical kit struck the ceiling and exploded, scattering bandages and instruments. The wounded men screamed, their bodies jerking against the straps that held them to the litters. The aircraft bounced twice more, each impact threatening to collapse the landing gear. The pilot stood on the brakes, but the wheels found little traction on the uneven ground. The C-47 continued forward at nearly 60 miles per hour, eating up the limited distance of the clearing. The far tree line approached with terrifying speed. 100 yards remaining. 75. 50. The brakes locked completely, the tires skidding across dirt and grass. The aircraft began to slow, but not fast enough. The trees were going to win this race. At the last moment, the left main gear caught a depression in the ground, a small erosion channel invisible from the air. The wheel dropped into the ditch and the strut collapsed. The left wing dropped, the tip striking earth and digging in. The entire aircraft pivoted violently to the left, swinging around its damaged wing like a compass needle. The tail came around in a wide arc. The right propeller, still windmilling from residual momentum, struck the ground and disintegrated. Pieces of blade flew through the air like shrapnel. One section, 3 feet of twisted aluminum, tore through the fuselage just aft of the cargo bay. It entered at waist height on the left side and exited through the right, passing between 2 stacks of litters with inches to spare. The aircraft continued its rotation, slowing as energy dissipated into twisted metal and torn earth. Finally, after what seemed like an eternity but measured perhaps 5 seconds, the C-47 stopped moving. Silence descended, broken only by the ticking of hot metal cooling and the hiss of hydraulic fluid spraying from ruptured lines. Dust filled the air thick enough to choke. The aircraft sat at a 45-degree angle, the collapsed left gear and damaged wing creating a severe list. The fuselage had been penetrated in multiple places. Sunlight streamed through holes that hadn't existed 30 seconds earlier. One of those holes, the gash torn by the propeller blade, had passed directly through the area where the patients were secured. Hawkins, stunned by the impact, pulled herself upright. Her training reasserted itself immediately. She began moving through the cargo bay, checking patients, calling out to those who were conscious. Most responded, some didn't. She reached the stack of litters near the propeller strike and found blood. A shocking amount of blood spreading across the deck. One of the wounded Marines, a corporal who had survived Bloody Nose Ridge, had been struck by the propeller blade as it tore through the fuselage. The damage was catastrophic. The propeller fragment had struck the Marine across the throat, severing his trachea completely. The windpipe, the essential tube that carried air from mouth to lungs, had been cut through. Blood filled the wound, pouring from damaged blood vessels, pooling in the severed airway. The Marine's eyes were wide with terror. His mouth opened and closed, trying to breathe, but no air reached his lungs. He was drowning in his own blood, suffocating despite being surrounded by oxygen. Hawkins had perhaps 90 seconds before brain damage became irreversible, perhaps 3 minutes before death. She dropped to her knees beside the litter, her hands moving with practiced efficiency. She needed to clear the airway, needed to create a path for air to reach the lungs. But the conventional methods were useless here. The trachea was severed. Tilting the head back wouldn't help. Mouth-to-mouth resuscitation was impossible with the throat torn open. She needed suction, needed to remove the blood that was filling the wound faster than it could drain. In a proper hospital, she would have sterile suction equipment, vacuum pumps, and catheters designed for this exact emergency. On the floor of a crashed aircraft on a remote island, she had nothing. The pilot appeared behind her, his face pale, asking what he could do. She didn't have time to explain. Her hands moved across the Marine's body, searching for anything that could be adapted. His Mae West life jacket, the inflatable vest that could keep him afloat if the aircraft ditched at sea, was still strapped around his chest. The jacket inflated through a tube, a rubber hose perhaps 18 inches long that connected to a CO2 cartridge. Hawkins tore the Mae West open, her fingers finding the inflation tube. She yanked it free, ripping it from its housing. The tube was perhaps half an inch in diameter, flexible rubber, hollow through its length. It would work. It had to work. She positioned herself above the wounded Marine, tilting his head to the side so gravity would help drain blood from the wound. With one hand, she spread the edges of the torn throat, exposing the severed trachea. With the other, she inserted the rubber tube directly into the airway, pushing it past the damaged tissue until it extended several inches into the windpipe below the injury. Blood immediately filled the tube. She placed her mouth over the upper end and sucked, drawing blood up through the improvised suction device. The taste was copper and salt, overwhelming, but she ignored it. She drew a lungful of blood into her mouth, turned her head, and spat it out. Then she did it again, and again. Each time she cleared the tube, The Marine could draw a single breath before blood filled the wound again. She established a rhythm. Suction, spit, breathe. Suction, spit, breathe. It was medieval, primitive, but it was keeping him alive. The other patients needed attention as well. Several had been injured by flying debris during the crash landing. One man had a broken arm. The bone snapped when his litter broke loose and struck a bulkhead. Another had reopened a chest wound, blood soaking through his dressings. Hawkins couldn't treat them while maintaining suction on the Marine's throat. She called to the pilot and co-pilot, instructing them in basic first aid, directing them to apply pressure here, to elevate a limb there, to check pulses and breathing. The flight crew, trained to fly aircraft but not to treat wounds, did their best to follow her instructions. Minutes passed. 5, 10, 15. Hawkins continued her desperate suction technique, her jaws aching, her mouth filled with the taste of blood. The Marine remained conscious, his eyes locked on her face, trusting her to keep him alive. She couldn't stop. If she stopped, he would drown. Her neck cramped. Her back screamed from the awkward position, kneeling on the tilted deck, bent over the litter. She ignored the pain. Outside the aircraft, the situation was equally desperate. The crash had been visible from a nearby village, and within minutes, native islanders began arriving at the clearing. They approached cautiously, uncertain what to make of the enormous metal bird that had fallen from the sky. The pilot, when he could spare a moment from helping Hawkins, tried to communicate with them using hand gestures. He needed to convey that they required help, that wounded men needed evacuation, that a radio message had to be sent. The language barrier seemed insurmountable. The Bologna Islanders spoke a Polynesian language completely unlike English, but they understood suffering. They could see the wounded men inside the aircraft. They could see the blood. Several of the islanders ran back to their village, returning with water, coconuts, and cloth that could be used for bandages. Others helped move patients who were trapped in awkward positions when the aircraft tilted. The hours crawled past. Noon became afternoon. Afternoon stretched toward evening. Hawkins maintained her suction technique without pause. Her entire world narrowed to the rhythm of clearing the Marine's airway. Suction, spit, breathe. Her hands trembled with fatigue. Her throat was raw from the constant suction. But she couldn't stop. Around her, the other patients stabilized or deteriorated according to the severity of their wounds and the limits of what could be done without proper medical equipment. The pilot had managed to convey to the islanders that they needed to reach the coast, that somehow a message had to get to American forces on Guadalcanal. Several young men from the village agreed to make the journey, running through jungle trails to reach the shore where they hoped to find a boat or perhaps another village with a radio. It was a desperate gamble, but it was all they had. Darkness fell over Bologna Island. The temperature dropped slightly, though it remained oppressively hot inside the damaged aircraft. Insects emerged from the jungle attracted by the smell of blood and the presence of motionless bodies. 19 hours passed before rescue arrived. 19 hours during which Mary Louise Hawkins maintained suction on the Marine's severed trachea, her body pushed beyond exhaustion into a state of mechanical endurance, where conscious thought ceased, and only muscle memory remained. Suction, spit, breathe. The rhythm became automatic. A cycle repeated thousands of times through the tropical night and into the following morning. Her mouth was raw and bleeding from the constant contact with the rubber tube. Her jaw muscles had long since passed from cramping into a numb rigidity that made it difficult to open her mouth between suctions. Her back had frozen in its bent position, vertebrae compressed by hours of maintaining the same posture. But the Marine was still breathing. His eyes, when they opened, showed recognition. He was alive because she refused to stop. The other patients endured their own nightmares. Those with untreated pain received what remained of the morphine supply, but doses had to be rationed carefully. Some men ran fevers as infections took hold in wounds that needed surgical debridement. Others lay in shock, their bodies shutting down from blood loss and trauma. The pilot and co-pilot did what they could, following Hawkins's instructions when she could spare breath to give them. They changed dressings, administered fluids, and provided comfort to men who cried out in delirium. The native islanders brought food and water, though most of the wounded couldn't eat. Their presence was a quiet blessing, a reminder that humanity existed beyond the violence of war. At dawn on September 25th, the sound of aircraft engines echoed across Bellona Island. A PBY Catalina flying boat, the versatile amphibious aircraft used throughout the Pacific for rescue operations, circled overhead. The pilot had received the distress message relayed from the coast and had flown through the night from Guadalcanal. The PBY couldn't land in the jungle clearing, but it could land in the lagoon on the island's north shore. The pilot dropped a message container attached to a small parachute, instructing the survivors to bring the wounded to the beach. What followed was an improvised rescue operation that combined American ingenuity and Polynesian generosity. The native islanders constructed litters from bamboo poles and woven palm fronds. They organized teams of carriers who would transport the wounded through several miles of jungle trail to reach the coast. It was backbreaking labor in oppressive heat, but the islanders worked with a determination that moved the American aircrew to tears. Each patient was carefully removed from the crashed C-47 and secured to a makeshift litter. Hawkins continued her suction technique even as the Marine was being carried, walking alongside the litter, never breaking the rhythm that kept him alive. The jungle trail was narrow and treacherous, roots crossing the path, mud sucking at feet, branches hanging low enough to strike the carriers in the face. The journey took 4 hours. 4 more hours of suction. 4 more hours of keeping one man alive through nothing but stubborn refusal to quit. When they finally reached the beach, the PBY Catalina sat in the lagoon like a graceful seabird, its hull gleaming in the morning sun. The aircraft could accommodate 12 patients on a single flight, meaning 2 trips would be necessary to evacuate everyone. The most critical cases went first. The Marine with the severed trachea was priority 1. Hawkins climbed aboard the PBY with him, still maintaining suction, her fingers cramped into claws around the rubber tube. The flight to Guadalcanal took 90 minutes. 90 more minutes of the same desperate rhythm. The PBY's crew stared in disbelief at the spectacle of a flight nurse who had been performing manual suction for nearly an entire day. When the aircraft finally touched down at Guadalcanal and taxied to the ramp, an ambulance crew rushed aboard with proper medical equipment. A surgeon took one look at the situation and immediately inserted a proper suction catheter, relieving Hawkins of her burden. Her hands wouldn't release the tube at first. Her muscles had locked in position, and it took gentle prying from the medical technicians to get her to let go. She collapsed onto the deck of the PBY, every muscle in her body screaming. Someone wrapped a blanket around her shoulders. Someone else pressed a canteen of water to her lips. She tried to ask about her patient, but her voice wouldn't work. Her throat was too damaged from the hours of suction. The surgeon understood the unspoken question and nodded. The Marine would survive. They would take him to surgery immediately, repair the trachea, and he would live. All 24 patients survived. Every single wounded man who had been aboard that C-47 when it crashed on Bellona Island lived through the ordeal and eventually returned home. The statistical improbability of this outcome was staggering. The crash landing itself should have killed several men. The hours without proper medical care should have claimed more. The Marine with the severed trachea, by any reasonable medical assessment, should have died within minutes of the injury. That he lived was due entirely to Mary Louise Hawkins and her refusal to accept the inevitable. The official military response came swiftly. Within a week of the incident, headquarters had compiled detailed reports from the pilot, co-pilot, and the rescue crews. Medical officers who examined Hawkins's improvised suction technique were both horrified and impressed. No medical textbook recommended such a procedure. No training manual described it. She had invented a life-saving intervention using materials at hand, guided only by an understanding of anatomy and a determination to keep her patient breathing. The recommendation for the Distinguished Flying Cross came from multiple sources simultaneously. The flight crew nominated her. The surgeon who received her patients at Guadalcanal wrote a commendation. Even the commanding general of the theater, when he heard the story, insisted she be recognized. The Distinguished Flying Cross was rarely awarded to nurses. It was primarily a pilot's medal, given for heroism or extraordinary achievement while participating in aerial flight. But the regulations allowed for exceptions, and this case clearly qualified. First Lieutenant Mary Louise Hawkins received the medal in a ceremony at Guadalcanal in October 1944. She stood at attention in a freshly pressed uniform, the medal pinned to her chest by a colonel who told her she represented the finest traditions of military nursing. The citation read in part, "For extraordinary achievement while participating in aerial flight in the Southwest Pacific area." With complete disregard for her own safety and comfort, Lieutenant Hawkins performed her duties in an outstanding manner under the most adverse conditions. The words were formal, bureaucratic, utterly inadequate to describe what she had actually done. But medals always were. The changes to aviation procedures and medical protocols came more gradually. The incident prompted a review of fuel planning for evacuation flights. New regulations required larger fuel reserves, accounting for worst-case weather scenarios. Alternate airfields were designated throughout the Pacific, giving pilots more options when faced with fuel emergencies. Medical training for flight nurses was expanded to include more improvisation techniques, teaching them to adapt civilian medical equipment for emergency use. The Mae West inflation tube was officially added to the list of equipment that could be repurposed for medical suction, though the training manuals noted that such use should be considered only in the most desperate circumstances. The story of Bellona Island spread through the medical air evacuation community, becoming a legend that new flight nurses heard during training. It represented both inspiration and warning, showing what was possible through courage and skill, while also illustrating the terrible situations these women might face. Mary Louise Hawkins herself returned to flight duty within days of the incident. Her throat healed, the raw tissue recovering its normal function. The psychological impact was harder to assess. She never spoke much about that night, deflecting questions with a shrug and a comment that she had only done her job. But those who knew her noticed changes. She was quieter, more introspective. She volunteered for even more missions as if trying to prove something to herself. The pilot of the crashed C-47 recovered as well, both physically and professionally. There was some question initially about whether he would face disciplinary action for the crash. A board of inquiry investigated the incident, examining fuel logs, weather reports, and the decision-making process that led to the emergency landing. The board concluded that the pilot had acted appropriately given the circumstances, that the fuel shortage resulted from unpredictable weather conditions rather than negligence. He was cleared of any wrongdoing and continued to fly transport missions for the remainder of the war. The C-47 itself remained on Bellona Island for years. The aircraft was too badly damaged to repair, and the cost of salvaging it exceeded its value. It sat in that jungle clearing, slowly being reclaimed by the tropical environment. Vines grew through the cockpit. Rain corroded the aluminum. Native children played in the fuselage, climbing through the same cargo bay where wounded men had lain. By the 1950s, little remained but scattered wreckage, pieces of metal slowly dissolving into rust. The strategic implications of the incident extended beyond individual heroism. The Battle of Peleliu, the operation that had generated the casualties requiring evacuation, was eventually recognized as a questionable strategic decision. The island's capture cost nearly 10,000 American casualties, and its airfields were never used as extensively as planners had predicted. War reveals character in ways peace never can. It strips away pretense and comfort, reducing humans to their essential nature under conditions of extreme stress. On a damaged aircraft on a remote island in September 1944, Mary Louise Hawkins demonstrated what one person could accomplish when faced with impossible circumstances. Her actions that night transcended military duty or professional obligation. She made a choice, moment by moment, breath by breath, to value another human life above her own comfort, her own exhaustion, her own limits. The significance of Bellona Island extends beyond a single dramatic rescue. It represents the largely untold story of military nurses in World War II, women who volunteered for danger, who flew into combat zones, who witnessed horrors that would haunt them for decades, and who saved thousands of lives through skill, dedication, and extraordinary courage. These women operated without the recognition given to combat soldiers, without the glory associated with flying fighters or bombers. They simply did their jobs day after day, flight after flight, carrying wounded men back from the edge of death. The incident also illuminates the intersection of technology and human resilience. The C-47 that crashed on Bellona was a marvel of engineering, a machine that could carry tons of cargo across thousands of miles of ocean. Yet all that technology became irrelevant when fuel ran out over empty ocean. In that moment, survival depended not on horsepower or aluminum airframes, but on a young woman's knowledge of anatomy and her willingness to use her own body as a medical instrument. The lesson resonates across decades. Advanced technology extends human capabilities, but it cannot replace human judgment, creativity, and determination. The Marine, whose life hung on a rubber tube and a nurse's refusal to quit, went home to his family. He lived decades beyond that September night, raised children, worked, loved, and eventually died of natural causes as an old man. He carried a scar across his throat for the rest of his life, a reminder of the closest he had come to death and the stranger who had pulled him back. Mary Louise Hawkins died in 2007 at the age of 86. Having lived a full life far from the war that had tested her so severely. Her obituary mentioned her Distinguished Flying Cross, but most of her neighbors had no idea what she had done on Bellona Island 63 years earlier. She had never sought recognition, never traded on her heroism. The medal sat in a drawer, a piece of metal that could never capture the reality of 19 hours on a jungle island floor, fighting death with nothing but determination and a piece of rubber hose. But history remembers what modesty conceals, and her story endures as testament to courage that needs no monument beyond the lives it saved.